injectables, the skin resurfacing techniques, and the non-invasive tissue folds. When is cosmetology booming? It is booming right now at this very moment because all in this metropolitan city, and who doesn't want to look good?
Doctor, what is the duration for these Botox filler sessions?
Botox and filler session, it depends on the product, and it would be written down on the product. But basically, a Botox would be viable for about 6 months of time, and fillers a minimum 3 months of time. It depends. We have a long-term fillers, long-term Botox. It all depends on the manufacturer's thing.
And doctor, what is the most common age group where these kind of patients approach us?
Age group can vary. People have started before 21, but I would suggest you all to start late. Start it at say after 21 years of age, which would be better.
So doctor, you're talking about Botox fillers. So usually from the patient's perspective, everyone, they think about, apart from this, a normal patient can approach us for this kind of treatments?
That is what most of the people think, that it's just about modulating your face, making your features sharper, and modulating and working on your face. So what happens is Botox is not only used for improving the aesthetic value of face, but it is also used in therapeutic treatments. The classic example from a dental perspective is the bruxism. Okay, in bruxism, what happens, there is tightness of muscle and the patient is biting on his teeth. In this case, what we do is we try and relieve the masseter muscle and the temporalis muscle. So it eases up on the patient, and the usage of the retainers is diminished. So most of the clients these days prefer the Botox treatment for the bruxism treatment.
I think most of them are not aware of this procedure. Yes. Yeah. So in case of relieving the bruxism, so how long the session should be?
On an average, it's done once in 6 months. Once in 6 months. Relieve the bruxism, and the patients are more happier than such that there's no need for them to wear on the retainers. Sometimes they have sharp ends, and even with the transparent retainers that we give, most of the clients don't use it, and most of them are kids, and they generally tend to not use it.
So doctor, hair transplant or trichology, it's another booming sector, and what is the role of a BDS or MDS doctor can do about this?
As I've told you, hair transplant and the Department of Trichology, as of now, an otomaxillofacial surgeon can be the lead surgeon, and the graduates, that is the BDS and the MDS from the other fields, can be the second lead surgeon, but he cannot be the lead surgeon for a hair transplant procedure. Okay, in case the particular fellow is interested in the field of trichology, then he has to enroll himself into an MSc program where he does MSc in trichology, and he has to go a rigorous 2 years course where he would be assessed, he would be trained, and he would have to do quite a lot of case presentation to the university, and thereon he can be the primary surgeon for your hair transplant cases.
So we're talking about the MSc courses, right?
Yes.
So these courses are available in which colleges?
There are universities, okay, and there is a council called as a Council of Clinical Cosmetology, Trichology, Regenerative and Aesthetic Sciences of India, where they have their own association, and this is the body that is regulating the field of cosmetology, and I am a part of it. I am the joint secretary of the Karnataka state and an additional secretary of Andhra, Telangana and Kerala. So what happens from the council, the council is affiliated to a lot of university, so the council would stand by and make sure the MSc goes through fine, and all the theory part as well as the practical part would be taken care by the university, and they would have to give their own set of protocols, and once the protocols is served, they would be graduated as MSc in Trichology.
So we can do on patients, right, when you do the course?
After the course only.
Only after the course. So during the course,
They can be the second lead surgeon.
Okay. What would be the fee structure for these kind of courses?
Fee structure, it varies, and that you need to reach out to the council, and the council will give you a thing, and you can go through the academy that we have. It's called the Sky Academy. The Sky Academy will help you get the courses for the MSc.
So, doctor, you're speaking about the course. Of course, most of the doctors are not willing to go for the extensive 2-year course. So, is there any short duration course which can help the
Yes, obviously there are fellowship courses where Sky Academies also come up with one of the courses. We are starting off with a course called Fellowship in Medical Aesthetics and Cosmetology, where we are only as of now training the fellows for non-invasive treatments.
That would be like?
The injectables, the skin resurfacing techniques, and the non-invasive tissue lifts. So these are the three treatments that we will be training the fellows and they can practice.
So, what would be the duration for these courses?
A duration of this course is 3 months online, then a 10 days hands-on course followed by a provisional degree. Once they finish the provisional degree, they'll have to provide us a case presentation. Once the case presentation is done and once we get once it's been scrutinized by the council and a clearance is given, we provide them the permanent certification, after which they can practice.
What is your opinion on the potential of cosmetology in the future and how fruitful it's going to be for us?
If you ask me, when is cosmetology booming? It is booming right now at this very moment, because we are all in this metropolitan city, and who doesn't want to look good? Okay, everybody is in the need of looking good. They want to look more aesthetic. Their presence matters. And mostly in my experience, to what I've seen, a lot of patients come in and ask about mostly about this whitening sessions, face whitening sessions, and they want to get rid of these lines, wrinkles, and a lot of patients would want to get their facelifting done. So what happens with this treatment is, this is not a permanent treatment per se. In case a patient comes to you and gets this treatment, fine wrinkles treatment, so what happens is, when you administer this Botox and fillers, it is for a duration of 6 months. After 6 months, if the patient is really had a good review over it and had good applause from his peers and friends, then he would obviously come back to the same person. First, suppose in case you have a spouse, so she goes to a particular beauty salon and she gets a very good facial done, and everybody is praising that praising your spouse, and your spouse feels good about it. The next time, no matter what, even if you relocate, your spouse is going to go to the same old salon. It's similar. So what happens is, here, once you administer Botox and you make sure the patient feels good about it, and the patient has a feel good factor, the patient will obviously come back to you. And it's a cyclic thing. The patient has to come back to you after every 6 months, and the patient is going to have a good relationship and harmony with you. And it's a constantly when a patient walks in, your revenue increases, you're more content and happy. So that is the thing. So in the future, you never know what is going to happen in the field of cosmetology, because cosmetology is evolving over a period of time. That is why nobody has got into the depth of cosmetology, and everybody's trying to get the bragging rights over cosmetology. So cosmetology is a field which is fast advancing, and you need to catch up with it.
So, do you think the Bangalore is in a very superficial level compared to Mumbai and other metro cities?
So, as in, I would compare Bangalore to Mumbai, which is the hub of cosmetology. But as of now, the number of specialists who are specialized in injectables are less. So, if you are really good at what you do, and if you can work on your skill, your work will speak volume for it. And once your work speaks volume, you will be well renowned and you will be called for. As of now, I consult in quite a lot of places, because it's not like I've evolved in a short time, in a short span of time. It has taken a lot of time for me to evolve. I've precisely worked on my skill. Now my work talks volume of my expertise. So that's how it is. So once you work on your skill and you keep modulating it, you try being the learner that you are, then you will evolve in this field of cosmetology. So cosmetology is something which will evolve, which will make you feel happy, and you're happy inside out.
I think as a dentist, definitely there's going to be a bright future for them.
Yes.
And yes, upskilling a talent is very, very important. And especially in metro cities, I think this can really fetch a good amount of money and confidence also. Especially we are more focused on, pain relief and other things.
Yes.
And when we combine these two, the smile design and the facial aesthetics is going to be a game changer.
Yes, the outcome is there. With dental treatments, it takes time for the patients to see results. But with facial cosmetology and cosmetology treatment, the results is then and there, and the patients are really happy, and they give you review in then and there, saying that they feel good about it. And best part about it, they get pampered over here. And facial cosmetology is all about pampering and evolving the face. And once the face changes, and once the minor glitches which the clients think they have is sorted and given to them, and they have this feel good factor, everything falls in place.
So that concludes the session for today. So, Doctor, any final message for our viewers, especially the ones who would like to join cosmetology?
I'm happy that I got this opportunity to share my knowledge to the viewers. My only suggestion to the viewers is to choose your mentors right. See, as long as your mentors are chosen right, and you can learn the skill the right way, then I think you can practice and make sure you yield good. At the end of it, you need to yield, and once you yield, you're happy. Because I am not with the people who tell they're not happy without the earnings, because at the end of it, everything comes to what you earn and how your lifestyle is. So in case you choose your mentors right, he or she will train you the right way. And always go to a mentor which has more of a workshop, more of a hands-on course. In a hands-on course, what happens, you need to have this touch, feel and do technique. Here in Sky Academy, what we are going to emphasize on the whole fact is for the patients, for the fellows to understand anatomy. We are emphasizing on the whole fact of people getting to know the anatomy. Okay, it's a touch, feel and do technique where they feel the muscles in different fellows. So what happens is we will make them understand the anatomy. The growth, the size of a particular muscle might vary in a differently built person. So we would mostly emphasize on those facts. Once they are clear with the anatomy and with the nerve innervations and the arteries and all these vasculatures, then we take them into the theory aspect of it. So in that way, I've been blessed to have wonderful mentors in my life. I have deep gratitude towards them, and I would like to uh, uh, send my heartfelt message to my mentors. My mentors are Dr. Parthasarathi and Dr. V.K. Swami. Thank you for what it is, and I hope to grow more in this field and would like to help my fellows in this my fellow fraternities in the same field.
Thank you so much, Doctor. It's been a very wonderful session, and I hope all my viewers have gained ample amount of knowledge regarding this, and I wish you all the best. Thank you. So that concludes the session for today. So stay tuned. We have a part 2 of cosmetology. See you in the next episode. Thank you.